Hello, and thanks for joining us today. I am happy to be here with you to share my thoughts on the current state of NPS. This is Donna Iula from Cayman Chemical, and I'm going to dive right in. Today, I will share Cayman's perspective on the current state of NPS, which is a collective effort on the part of this incredible team shown here on a sunny day in Ann Arbor, Michigan. I can't thank them enough for their dedication and expertise and for sharing my passion for the work that we do for our forensic chemistry and forensic toxicology colleagues around the world. Our team takes in a lot of information from many different sources on a daily basis. This information shapes our reference standard production queue and helps us prioritize our chemistry to ensure that we're allocating resources to the most impactful NPS and their respective metabolites. We have a team regularly perusing online marketplaces and chat rooms. We actively collaborate with international partners to decipher analytical data from drug seizures. We monitor trend reports, and we also have constant communications with labs around the world about what standards they need as a result of what they're seeing in real time. Regarding the current state of NPS, derived from those various intel efforts across the major classes, I would say that the most activity lately has been with the synthetic opioid class. Over the last few months to year, we've learned of many new nitazines, new orphines, along with the rise of new methadone analogs, and the surprising emergence of very potent semi-synthetic opioids derived from kratom alkaloids. Regarding synthetic cannabinoids, stimulants, and hallucinogens, we've seen a few new substances here and there, but nothing really significant to note today, other than maybe what appears to be an increase in new PCP ketamine-like analogs, or what we refer to as aryl cyclohexylamines. We've noticed a rise in ethyl triazolo benzodiazepine NPS, many new etomidate analogs, which the UNODC has also issued warnings about, new tianeptine analogs, and we've heard of a rise in the prevalence of local anesthetics. Since synthetic opioids have been creating a lot of buzz, and they are also the most concerning from an overdose perspective, I wanted to spend a little bit more time diving into this NPS subset. Like what we saw with the fentanyl analog proliferation, we're seeing many new nitazines and orphine analogs where multiple regions of the scaffold are being tweaked, seemingly for the sake of structural diversification and to avoid detection. Given the number of regions where modifications are both synthetically feasible and potency is retained, we will probably continue to see more analogs appearing in 2026. The areas I've highlighted in teal, blue, yellow, and gray can and have been exploited on the illicit market to make new analogs. As compared to the prototypical nitazine, edonitazine, these recent examples highlight those tweaks made to one or more of those regions. You can see an ethylene bridge where there would typically be a methylene linker in the top compound on the left. You see a swap of the nitro group for cyano group in the top center compound, a deviation from the typical alkoxy groups that you would normally see for fluorines in the structure on the top right, butadesnitazine on the lower left represents a nitazine where the nitro group is absent. These all represent new nitazines that we've been made aware of and that we've created reference standards for. The numbers below the name are our product numbers, added for your convenience should you need to make a positive identification in your casework. We do our best to add synonyms to our product pages, but it can sometimes be a challenge to find what you need. So I hope this slide can come in handy for you in the future. Given the recent changes with regard to the structural class in 2025, we've updated our nitazine snapshot, and we've also created a new lab guide wall poster to summarize what is known about this class. I believe if you visit the virtual vendor booth, you can access these tools. My team and I put a lot of effort into these, so I hope that you continue to see value in them. With regard to brorphine analogs, or what we simply call orphines, this structural class has also seen an increase in the emergence of new analogs where those regions that I highlighted on an earlier slide have been tweaked. Recently, we've also seen spirocyclic versions shown on the top row in the center and on the right. And we've also heard a lot about these azithramides, which share a lot of the orphine components, as well as structural elements resembling other synthetic opioid classes. They're yet another series of opioid analgesics discovered by the Janssen pharmaceutical company. To help summarize this potent and emerging class, which some believe may increase in importance since the 2025 nitazene ban in China, we created a snapshot which summarizes key details and important information. Again, I believe that you can access this in the virtual vendor booth, but you can also find them on our website in our forensic literature section. So unlike the fentanyl analogs, which were very localized to North America, the nitazenes and orphines seem to be more of a global threat. Almost every day, we see a new publication or news story or a new government alert. Here are just a couple of screenshots from some recent reports where, for example, we're seeing studies indicating that they're being detected in wastewater in Australia. And on the right, very recently, there were reports of orphine analogs causing overdoses in the UK. In this particular report, highlighted here, it is believed that cyclorphine, also known as propionitrile chlorphine, was the culprit. Last year, we shared results of an in vitro human liver microsome metabolism study on this particular molecule. And we heard from some of our colleagues in the UK that it was very helpful to them as they were interpreting data from those cases. What is complicating the picture even more, aside from these synthetic opioid structural classes, is the rise of what are called semi-synthetic opioids. Given the importance of these and the confusing nature of them, I thought it was useful to sort of review the terms. So natural products, as the name implies, are compounds found in nature. Think of psilocybin from psilocybe mushrooms, morphine from poppy plants, or delta-9 THC from cannabis. Even biological metabolites can be thought of as natural products. Synthetic molecules are made in the lab, and most of the NPS that we encounter, so the nitazenes, the orphines, the benzos, are purely synthetic. Keep in mind that while something can be a natural product, it can be manufactured in a lab. For example, Cayman's psilocybin standard is not extracted from mushrooms. It is purely synthetically made. So one must keep in mind the distinction between theory and practice. To complicate things more, molecules extracted from nature can then be brought into a lab for further synthetic manipulation. Delta-9 THCO acetate is an example of that. It is made by intentional synthetic manipulation in one step from delta-9 THC, and it's therefore referred to as a semi-synthetic. I wanted to broach this topic of semi-synthetic opioids because of the sudden rise of all these attractively branded consumer products flooding the quasi-legal market that resembles a lot of what we saw with the rise of semi-synthetic cannabinoids. The uncertain legality, the confusing branding, the questionable compound compositions, and the questionable links to natural substances and the unsuspecting consumers. Here in the US, in July of 2025, the FDA issued a press release around the push to make such products illegal. So 7-OH stands for 7-hydroxymetragenine, and while it may be present in small amounts in nature, the molecule found in most of these products are almost certainly semi-synthetic. 7-hydroxymetragenine can be made in the lab in one step from metragenine, which is the most abundant alkaloid in kratom. At the federal level here in the US, natural kratom is legal. So the difficulty for analysts, whether it's seized drugs or toxicology, is answering the question, are we looking at a true natural product or a lab manufactured concentrated version of its components? And this would be important because it could have legal implications. There were reports in 2025 of raids on US-based operations synthesizing 7-OH for consumer reports, such as this one in Kansas City that I've highlighted here. Interestingly, confident that what he was doing was beneficial to society, the owner even allowed a news crew into his facility to film their operations. So I believe that we're still in the middle of watching this battle between those wanting to keep the natural kratom plant legal for the many advocates who see the health benefits of it, and the need to protect the unsuspecting consumer from these super concentrated gas station, smoke shop, tinctures, pills, gummies. It's going to be interesting to see how this ends up working out. This afternoon, 2 scientists on my team, Dr. Camille Watson-Gooden and Nathan Lale, will present an in-depth workshop exploring the chemistry and pharmacology of these kratom substances and the semi-synthetics derived from them. So since they're dedicating a whole hour to this topic, I will just simply note that mitragynine is the primary alkaloid, the primary substance found in kratom. Its main potent metabolite, 7-hydroxymitragynine, and its degradation rearrangement metabolism product is called mitragynine pseudoindoxyl. So as you move from left to right on the slide, the molecules become far more potent opioids. Even more alarming is the rise of something called MGM15, which the CFSRE's NPS discovery team and my team here at Cayman have renamed dihydro-7-hydroxymitragynine. Please note that this potent opioid is not found in nature. It does not exist in kratom, nor is it a metabolite, but it can be synthesized from natural products isolated from kratom. It was initially manufactured and reported as part of legitimate scientific research years ago, but it's now resurfaced in this 2025 Drug Testing and Analysis article, noting that it's been identified in products intended for human consumption. For a review or a summary of this topic, please refer to yet another new snapshot that we came out with last year. You should be able to find this at our virtual Cayman booth. Also, the Cayman team, who are very knowledgeable on this topic, will go into this in a lot more depth at our workshop later, so please tune in for that. As a final slide, I have illustrated the structural diversity of what drug chemists are currently being challenged to identify. Some pose analytical challenges I don't have time to get into due to their instability, but please be sure that these are on your radar. If you haven't encountered them yet, you may do so. Please reach out to me if you have any questions about them. I'm happy to go into more depth about any of these substances. So thank you so much for your time and attention. Please sign up to receive notifications about the new NPS that we're detecting, to hear about any new snapshots that we've developed. You can also join us on LinkedIn. You can email me anytime. And there are, just lots of ways that you can stay on top of this changing NPS market. Thanks again, and be sure to attend our workshop later. Bye-bye.